We'll start with by far the hardest hit country in Africa, South Africa, where a state of emergency was called as COVID-19 cases shot up past 500,000. Those restrictions have now been lifted, partly to try to revive a flagging economy. There's a real problem with rising unemployment and even hunger. But some of the fastest reaction to these multiple crises has come not from the authorities, but self-organising groups. They're called Community Action Networks, or CANs. We've been hearing from public sector doctor and health systems activist Leanne Brady and community organiser Nadia Mayman, who've come together in the network Cape Town Together.
I mean, this is a health crisis, of course, but the socio-economic impact of this health crisis is really, really intense. And I mean, in the work that we've been doing, certainly those kind of consequences of the crisis have been hugely difficult to manage. During the lockdown, many people have been without income, without access to food, some without access to water as well.
And Nadia, what have you been seeing? What do you think has been most difficult?
I think for our community, that is basically a working class community, the assistance from the state has not been forthcoming, and as a result, our people felt that they would die of hunger rather than of the disease. And that has made it extremely difficult for us because we've had to respond in various ways.
When you tell me some people feared they might die of hunger, some of our viewers might think Cape Town, the Cape Town area is wealthy. What's going on?
That is not our daily lived realities on the ground. You've got areas where unemployment is rife, and on top of that we were faced with this pandemic, and it's been extremely difficult for community-based organizations to respond during this difficult time at the best of our ability without any aid.
So Leanne, tell us more about what you've been doing within Cape Town Together to deal with these actual realities.
The first thing to say, to build on what Nadia said, is of course Cape Town is an extremely divided city, and what COVID-19 did is it shone a light on and amplified the deep inequalities that we have in our society that are long-standing and historical. And Cape Town Together kind of emerged in this context. So it was kick-started by a group of social activists, community organizers, and public health professionals as a rapid community-led response to COVID-19. It's made up of self-organizing neighborhood-based groups who are taking action in their own local neighborhoods. And many of us are part of the CANs in our neighborhood. So, for example, I'm part of the Salt River CAN. Nadia is part of the Bonteheuwel CAN. And while we take action in our local neighborhoods, we also seek to connect across the city, because in a city as divided as Cape Town, organizing across race and class and social divides is extremely important, always, but especially at a time like this.
What kind of actions have worked best?
There's a huge multitude of things that have happened, because each neighborhood is different. There's no one size fits all, and people have been responding in different ways based on what challenges they face, based on the challenges we face in our own neighborhoods. And that has ranged from mask making to mobilizing around access to water, to setting up community care centers, to going door to door with pamphlets safely to kind of to spread information and awareness. So the kinds of actions we've seen have been have been incredibly powerful and incredibly varied. There's also been phases of action. So, for example, in the beginning, when we were all still learning about what COVID-19 was and what it meant for us as a society, there were a lot of activities that focused on mobilizing around awareness activities. But after the hard lockdown, as food insecurity became such a challenge for so many people in the city, people started delivering food parcels. When food parcels couldn't go far enough, people set up community kitchens, and hundreds of community kitchens have sprung up across the city, where people are cooking, often in their own homes, for their neighbors. what we now see is more and more CANs starting to work towards setting up sustainable food systems to keep these community kitchens going. We've also seen very powerful actions of providing COVID care at the neighborhood level. So with something like COVID-19, 85% of people don't need hospital care, but they still need care. And because many people in Cape Town are unable to isolate in their own homes, staying home safely if you have COVID becomes incredibly difficult.
Nadia, this sounds like some remarkable collaboration. How has it felt to you, the way things have come together?
For us as a community, it has been absolutely amazing. There's no doubt that we as a community would have responded in our own little pocket, but having been part of the Cape Town Together network has strengthened us with regard to, and not just resources, but also education and working together across race and class and spatial divides, which Leanne has highlighted. And one of our desires is that post-lockdown and post-COVID that we can continue working across these divides to building a better society for all.
Nadia, I remember reporting on the great hope that came with the beginning of true multiracial democracy in South Africa, that sense of optimism.